welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and I have a recent research to share with you all today. The study published in the Journal of Postgraduate Medicine, Education and Research PGIMER sheds light on the most important causes of neonatal mortality in India. Now, in our country, the biggest question posing is managing neonates and children in the need of positive pressure ventilation with manual ventilation are not an uncommon practice. That is basically due to the lack of adequate resources, but it's basically due to the lack of data on the outcome of manually ventilated neonates. Now, this study was conducted to determine the short-term outcome of manually ventilated outborn neonates admitted in a pediatric emergency of tertiary care hospital in northern India. The retrospective study was conducted involving close to 131 outborn neonates who were manually ventilated with self-inflating bags. The details regarding their demographic variables, the perinatal period, treatment received, ventilation, the reason for intubation and positive pressure ventilation, the duration of intubation, the complications related to positive pressure ventilation, diagnosis, and final outcomes were all the factors that were noted. The mean age of neonates was around 5 days and 76% of them were males. The common diagnoses were hypoxic ischemic encephalopathy, early onset neonatal sepsis, late onset neonatal sepsis, and hyaline membrane disease. The survival rate was accounted for approximately 22.1% and 45.8% of the cases even died and 32.1% left against medical advice. So in conclusion, it was said that 1/5 of manually ventilated outborn neonates did survive. Complications related to their positive pressure ventilation and pressure of shock and hypoxic ischemic encephalopathy were an independent predictor of poor outcome. Therefore, the facilities for the care of outborn neonates need definitely to be an upgraded system, but in the setting where these facilities are not available, the provision of manual ventilation may save a significant number of babies. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.